Hi, everyone. My name is Farah Sheikh. I am programming chair for the BCVS Specialty Conference, and I'm joined here today with the chair-elect.
I'm Jen Davis.
And we are here interviewing Dr. Jonathan Epstein, who is giving our amazing keynote lecture. I think it's taken us a while to get you here, but we're so happy to get you here. And we are really excited to hear about your area of research. And I was wondering if you could give us a little bit of a sneak peek into sort of what you're going to talk to us about at the lecture. And I know you're using emerging technology. So where do you see that playing a role in cardiovascular research?
Sure, I'm delighted to be here, and thank you for your persistence in asking me to come. So I'm going to talk about work I'm very excited about in the lab over the last number of years, developing the concept that we could engineer the immune system to treat cardiac fibrosis. And it's an idea taken from recent advances in cancer biology, where CAR T cells have been so successful in treating leukemia and lymphoma. And a student in my lab had the idea that perhaps we could adopt that strategy to target actively proliferating cardiac fibroblasts. And that's panned out to be quite successful, at least in animal models. And we've developed ways to generate those CAR T cells with mRNA and lipid nanoparticles that could bring down the cost of CAR T therapy quite significantly, and also make it accessible around the world as a simple shot instead of a complex engineering problem, taking the cells out, engineering them in the lab, growing them, reinfusing them in each patient. That's how that therapy is done now for cancer. And it's very expensive, hundreds of thousands of dollars per patient. And we think you could accomplish a similar end by using mRNA and lipid nanoparticles, a modification of the COVID vaccine, to do a similar therapeutic approach at much lower costs. So that's what the work I'll talk about today.
Wonderful.
That's great. I'm going to switch gears a little bit and just ask you about your career trajectory. And we were wondering if there were any mentors during your career development that really influenced your trajectory, and how did they do it?
It's an important question. I often think that the very earliest exposures I had to science as a high school student and a college student really influenced my approach to science. I had the good fortune to be able to wash dishes at a marine biology laboratory on the coast of Maine.
Oh, wow.
And what I learned there was that science was fun. And everybody was very open about what they were doing. They were excited about their research. It seemed to me you got to do things with your hands and see the product. And that's where I caught the bug.
Wow.
And I think that if I had first been exposed to science, where I later worked at Harvard and MIT, and where it was very competitive and people weren't so open about everything they were doing, I'm not sure I would have caught the bug the same way.
Yeah.
So I think I was lucky in that regard.
That's great.
So I'm going to ask you, because you have many roles, physician, scientist, and now dean, which role has taught you the most and been sort of the most challenging, and how did it teach you something?
Yeah, I have enjoyed taking on different roles over the years. I'm still passionate about the research in my laboratory, and I still try to get to the laboratory every day. But I have played a role as chair of a basic science department and as chief scientific officer at the University of Pennsylvania, and now as dean of the medical school. And in each case, it's been new challenges and new opportunities that I've enjoyed. I think one of the fallacies, and I try to convey this to others, is that it's a sum neutral game, that if you take on administrative duties, you necessarily take away from your research opportunities. And while there are challenges in taking on multiple roles, I've found that I learn a lot from my administrative roles that influences my science. And one example is that when I was chief scientific officer, I knew about Drew Weissman's work with mRNA long before COVID. He was working on HIV vaccines, and that's when we started collaborating. I'm not sure I would have known about Drew's work if I hadn't been the chief scientific officer. I was in cardiology, after all. He was in a totally different field.
Right.
So I think sometimes playing these other roles gives you exposures and hence ideas that you might not have had otherwise.
Do you think this exposure or this path that you've taken has given you some ideas of what you might give trainees in terms of their advice on their own career
I
trajectory?
don't think I'd wish my path on anybody
Yeah,
else,
yeah.
but what I tell trainees is follow your passion.
Mhm,
And I think almost all of us do better at things we enjoy than trying to force a square peg in a round hole.
mhm,
And so, I think we all have to be honest with ourselves about what aspects of our work we really enjoy. And none of us like every aspect of our job, but there has to be some aspect that you're passionate about in order to do it. And I think sometimes people take positions because they're prestigious or
right.
because they think it's the right next step or because other people tell them it's the next step.
Right.
Mhm,
But if it's not driven by their own internal passion, they don't usually do very well at it.
right.
So I think that's a really important sort of to be honest with yourself
Mhm,
about what you like and what you're good at each stage.
that's great advice.
Yeah. So I wanted to switch gears a little bit. You talk about passion and energy. What energizes you outside of science to keep you going? And I unfortunately I have been on your Twitter in the past, and I've seen some pictures of some great looking food. So I'm wondering, is that is that part of your
Well,
recharge?
Well, I'm not on Twitter or X anymore.
Right.
I've stopped that. But I did enjoy posting some pictures at one time of the food that I like to cook, and I do find it relaxing to cook.
Mhm.
I don't think it's that different than doing experiments in the lab, actually. But especially during COVID, my wife and I spent a lot of time cooking together, and she's an excellent cook and taught me a lot. And I've enjoyed making pasta, as you say, and a number of other dishes. So that's a nice escape.
Terrific.
So, I mean, thank you again for taking the time to instill us with all your knowledge, your sort of vision of where research is headed. And so we're excited to see your talk very soon today. I want to thank you so much for coming here
I
from
hope I
behalf
don't
of
let you down in the
you
talk.
won't, you
Oh,
won't,
yes,
you
hopefully
won't. Thank you so much.
Thank you.